I'll share you a chart on the screen showing you the size and how the artery looks, how the veins looks, how the venules looks, and what is the capillary. I'll share you the picture, and I also will share you the cardiac cycle, how the heart functions. I'll share you the systemic circulation and pulmonary circulation, the mechanism where the blood is circulated from the heart to the different parts of the body, and pulmonary circulation from the heart to the lungs, and then getting the oxygenated blood back to the heart. So, this chart you can you see, go through the chart and you will understand in depth about the cardiac cycle and other heartbeats and how the heartbeat is generated. For a basic understanding of a yoga teacher, these many things are enough, but for the person who wants to know advanced one, you need to go for the level 2 practices where we will deal with this in much details. So, next component of cardiovascular system is the blood. So, the blood have two components, one is a plasma and second one is the cell component. The plasma is the liquid portion of the blood when it is centrifuged. If you take the blood and we will put it in a centrifuge machine and we will rotate the tube with maybe 100 or 1000 rotations per minute, something like that, and it will segregate the plasma part separate and blood cells part separate. The plasma contains the fluid portion of the blood, which contains salt, some chemicals, some hormones, some antibodies, and some storage components. And the cell component contains three things: red blood cells, white blood cells, and platelets. So, this chart will explain you about red blood cells, white blood cells, and platelets and its different functions. And in our body there is around 5 to 6 liters of blood. The color of blood is because of the hemoglobin and the red blood corpuscles. So, these RBCs are nuclei-less biconcave flat cells of the body called as red blood cells, which lives up to the age of 120 days. That is why when somebody is having blood sugar, if they check the test called as HbA1c, it means excess of blood sugar will go and get accumulated on the surface of red blood cells, and it will sit there and it will not be taken out. And the lifespan of red blood cells is around 120 days. In 120 days that cells will die or it will be destroyed by the spleen or other systems to produce a new blood cells. So, during this time the sugar levels can be noted and monitored. So, main function of red blood cell is to transport the oxygenation and carbon dioxide to and fro from the heart and lungs. So, white blood cells there are 5 varieties of white blood cells: leukocytes, neutrophils, monocytes, basophils, and eosinophils. And there is a basic connection between the beta cells, C cells, we call it as a pluripotent cells, from which the two divisions of white blood cells will come out. One will be a beta cells and T cells and B cells, other set will be these 5 white blood cells. So, each one of them have a different functions. Usually it works as an army of your body, where it will fight with bacteria, viruses, or ingrowing infections in the body, and it will fight it out. So, these are white blood cells. Platelets are the factors responsible for stopping the blood coagulation. We will call it as blood stopping. Wherever there is a cut or wound in the body, there is a 2 mechanism where body will stimulate the fibrinogen. We call it as a blood coagulation system. It will be activated and it will send a signal to the platelets saying that go and get stuck to the open wound area. There will be mesh like structure will come. It will be formed by the help of fibrin, and on the fibrins these platelets will go and aggregate, and it will block the blood wastage or blood bleeding. So, that is a function of platelets. So, these 3 are the main component, cell component of the blood and plasma. So, blood group also we will discuss about this blood group and other details in your detailed version, but not in this. But this chart shows you about the red blood cells, white blood cells, and the platelets and its functions.